Hi, I'm Liz Petrick, licensed cosmetologist and also operations manager for ASCP and AHP. Today we're going to be talking about thinning hair. As we know, thinning hair is an all too common issue that no one really loves to talk about. It can be an uncomfortable or an embarrassing topic for the guest. They may not know how to bring it up, or they can also be quite sensitive about the topic. Under normal circumstances, the average person loses roughly between 50 to 100 strands of hair per day. Normal daily hair loss is the natural result of our hair growth cycle, which is a process of anagen, our growth phase, catagen, our transition phase, and telogen, our resting phase. When people think of hair loss, generally they think of male pattern baldness, thinning in the crown area, or may notice a thinner ponytail. Yet surprisingly, over 63 million people in the United States suffer from abnormal hair loss. As a licensed professional, it is likely that you will be the first person that many of these people will come to with questions about their hair loss, and likely the first person to broach this topic with them. So let's get a little more granular and let's talk about what is the difference between normal shedding and excessive shedding. First, we want to educate ourselves on this so we can effectively help our guest. Normal shedding, as we discussed, is the natural amount of hair that we lose daily. This is often seen as strands of hair in our hairbrush, loose strands on our clothes, or stray hairs that we see on the floor. This is all normal, and normal shedding comes in waves as our natural hair growth cycle goes through its normal phases. Now, excessive shedding, or also known as telogen effluvium, is common in people who have experienced stressors. Those stressors can include losing an excessive amount of weight, someone who has given birth, someone who has experienced a lot of stress, such as divorce, losing a job, loss of a loved one, or as we've experienced in the past year, the impact that COVID-19 has had in our daily lives, recovering from an illness, undergone an operation, and even someone that has stopped taking birth control, as this is a change in normal hormonal balance. Most people that have experienced the mentioned stressors will notice excessive shedding within just a few weeks to a few months of whatever event that they have experienced. Now, as the body readjusts to overcoming these stressors, the excessive shedding will stop and the hair will regain its normal fullness. However, if the stressor stays with the person, the excessive shedding may not go away. Now let's talk about hair loss. This is different than hair shedding as we just discussed. Hair loss, or also known as anagen effluvium, occurs when the hair stops growing. Now, some of those causes of this can also include androgenic alopecia, also known as hereditary hair loss, such as male pattern baldness. Men will develop a receding hairline or a bald patch that begins in the crown area, whereas women may notice gradual thinning and can eventually have patches where no hair grows. Drugs or treatments such as chemotherapy, hairstyles that pull excessively on the hair, causing it to pull out from the root, or alopecia areata, which is a sudden falling out of the hair in round patches or baldness spots. These spots can be singular or multiple in smooth patches. Now, some hair loss may require treatment. In some cases, such as a chemotherapy patient, once they stop the medication, the hair can grow back. However, in other cases, such as hereditary hair loss, some topical or surgical procedures can be done to help promote new hair growth. We can also talk to our guests about prevention for normal hair loss, such as avoiding hairstyles that consistently pull on the hair, such as tight braids or ponytails, avoiding high heat styling tools that can dry out the hair strand, causing additional breakage over time. There's also chemical services. How often is it recommended, and how often are they done, and how to maintain the integrity of the hair in between those chemical service visits. Also using a silk pillowcase or hairbrush made of natural fibers that will help distribute the natural sebum throughout the hair. Getting frequent scalp massages to help promote hair growth with blood circulation, and let us not forget about the scalp condition. This is just as important in hair growth as it is for hair loss. Now, for example, ringworm of the scalp is also known as tinea capitis. This can make hair brittle and lifeless, leaving the hair to break off. Psoriasis of the scalp or even dandruff can cause hair loss as well. A healthy scalp promotes healthy hair growth. Make sure that as a professional, you are examining the scalp during your consultation or conversation with your guest. Now let's talk about a few things that we can do as licensed professionals to help with this emotional impact that they may be feeling and how we can broach the topic. First thing we want to do is we want to create a safe space for them. We always want to make sure that clients feel safe and that judgment is off the table. Gossiping about clients is a no-no because it implies that we are subject to judgment as well. Also, note that some guests may not feel comfortable talking about their thinning hair in front of others. So when bringing up the topic, you may want to lower your voice or turn the guest's chair away from others if needed to create a more personal space for them. It is also just as important to have active listening skills when having the conversation with your guest, as that is to also creating the safe space. Listen to their needs, listen to what they are saying. If it is important enough for them to bring it up, it is just as important for you to listen. We want to be patient. We want to know that what they're telling you may be hard for them to communicate it, as it has an emotional impact on them. And we want to also have good eye contact. We don't want to look away or occupy ourselves with doing something else. We want to be positive and use positive body language, but don't keep your arms crossed. It may make you seem closed off. And acknowledge what they are saying with nonverbal cues, such as a head nod. And in addition to having a safe space and active listening skills, how do we broach the subject? This can be a sensitive topic for many, especially in women. Some clients may be eager to bring it up with a professional, but might not know how. This is your cue to open the door with initial questions, such as, if there's anything you could change about your hair, what would it be? Is there anything you dislike about your hair? Have you noticed any difficulties in your hair lately or any differences? Or do you have any concerns with your hair? Listening to their answers is a perfect gateway to bring up the topic. If the guest suggests that they wish they had fuller hair or it was thicker, or if they've noticed excessive shedding, this is a perfect opportunity to bring up products or techniques that may help them and their situation. These questions can also be asked to both men and women. Keep in mind that men, as a rule, don't like a lot of change or too many steps in their hair care routine. So if suggesting a product to them, have them start out with 1 or 2 items and add more as needed as time goes on. It can be overwhelming at first, and they may be hesitant to do it if too many products are thrown their way. Now, when asking questions, know that the consultation is key to any service, and especially recommending what products or techniques may be best suited for your guest in this type of situation. You want to empathize with the client, understand their feelings, concerns, and questions they are asking and sharing with you. You want to attentively listen to what they are saying, listen to what bothers them, or what they want to change about their current situation. You want to acknowledge their feelings and know that they are not in this alone, and let them know that also other people share the same feelings and frustration that they may be feeling too. Now, as for your regular clients, the topic of thinning hair can be a little easier to approach, as you will already be aware of their texture, growth patterns, and natural inclination to the topic. With a regular client, you may notice thinning patterns, density starting to thin out. This can be brought up as, I've noticed some changes in the thickness of your hair. Is this something you've noticed too? Or, I've noticed some thinning in your crown area. Is this something that bothers you? At any point during the service, this can be addressed. It doesn't have to be reserved just for the consultation. Thinning hair can be brought up in the beginning, during the service, or during styling. You, as a licensed professional, would get a feel for how your guest may react and how the relationship forms to approach it accordingly, and at what time. I would not, however, bring this up at the counter while rebooking the guest or paying for the finished service. This will not leave ample time to discuss the topic, and they may not feel comfortable if other people are standing around. There are a few do's and don'ts I would suggest in order to maintain trust and making the guest feel comfortable. Don't refer to thinning hair as balding. Simply refer to it as loss or thinning. Don't feed into your client's emotions. This can cause alarm and can make them feel uncomfortable. For example, if they're upset about their hair loss, don't react with them, rather act, educate, and offer solutions. Don't joke about it or brush off the subject. This can come off as you not taking it seriously and think it's funny, whereas they may not. Do recommend key products for them, such as volumizing products, shampoos, or conditioners that may aid in the hair appearing fuller and also thicker. Do ask what their normal everyday hair care routine is. This will help you determine what steps and products to recommend that will fit into the time they have allotted every day to help their individual situation. such as using dry shampoo or even coloring techniques to give the appearance of depth and more movement. Do you recommend more styles or new styles, such as a new layered cut, a different part, adding volume back into the hair by back brushing or French lacing the hair? And do you recommend vitamins that may help promote hair growth or ways to help reduce stressors if they happen to mention any? Do suggest both topical, surgical, and non-surgical options for your guests so they know that there is many options to choose from. When we can identify key features, we are then able to properly help the guest with what their hair care needs may be. For some, it just may be a different way of styling the hair or using different products, such as volumizing shampoos, conditioners, or styling aids, or it can simply be a new color and cut with layers to create more fullness. This could also be a part of knowing what surgical and non-surgical options that are out there to share with your guest. Most importantly, we need to educate our clients. They come to us because we are the expert, so we need to show them and walk them through what we are doing and why. If we are using a product that has peptides or silica in it, it can give the illusion of fuller hair since it attaches to the hair strand. Using that as an example, explain this to them and make sure they understand what you are using, why you are recommending it, and how you would use it effectively. As the expert, it is just as important to educate our guests on ingredients that help our hair, but also the ingredients that can harm our hair or cause unnecessary breakage, such as heavy oils or sulfates that can weigh the hair down, giving the opposite effect of fullness. Take the time, as a professional, to do your research. Look into ingredients that are in products to understand how they can help or harm our guests. Knowing these keys will help aid you in the right products for the right person for their individual situation. As we discussed, thinning hair is an all too common issue that as a licensed professional, you may encounter daily in your profession. How we approach it, communicate solutions, possible causes, and ensuring we are making our guests feel safe in our conversations will give both them and us the necessary tools needed to help them. I am Liz with ASCP and AHP. It was great having you join me today, and I look forward to seeing you again soon.